My name's Karen Murphy. I'm the Chief Executive of the Northwest Hospital and Health Service here in Mount Isa.
And I'm Christine Mann, Executive Director, Aboriginal and Torres Strait Islander Health.
And we just wanted to take this opportunity today to speak to you about what our plans are to meet some of the requirements that our Prime Minister has discussed over the last couple of days. So as you're all aware, we're in the midst of a coronavirus pandemic, and all of the staff and all of the supporting organisations associated with the Northwest Hospital and Health Service have been working very hard behind the scenes in the last 3 or 4 weeks to make sure that what we're doing here is protecting you as the public. One of the things that we need to tell you about today is that we are going to be closing the doors of the hospital to people who are here unnecessarily from midnight tonight. As you know, the Prime Minister has said that we need to reduce and restrict all movements of people to keep us safe from this virus. The best way of doing that for us in all of our hospital sites is to actually have a front door check. So from midnight tonight, all of our hospital and health services sites will have a front door check. What that means is that patients that need to be seen by doctors and nurses urgently will of course be allowed in, and we'll have a process and a flow for that to happen. But we ask all of you to consider, if you are hoping to attend a hospital or health service site with a family member or a friend or a relative, we need to ask you not to do that. Unless your family member or friend actually needs to have you there with them, or you're the parent of children that you need to accompany, we will not be able to let you into the hospital. We want you to be patient with us when we are asking you questions at the front door, because we need to keep you and our staff safe from this virus as much as possible. So what we'll be doing is we'll be asking you a series of questions. We'll be checking to see where you need to go in the hospital, if that needs to be into radiology or if that needs to go and see a doctor or a nurse. And at some stages we will be taking temperatures of people that are attending the hospital. We know this is a really difficult and distressing time for you all, and we know that you are all trying your hardest to reduce and restrict that transfer of any viruses. And we really appreciate all of the work that you've all done to date to reduce trips, transfers, working out in your gyms. It really is going to make a difference to the Northwest Hospital and Health Service and to all of you to reduce that potential for transfer of virus. But we need to go the next step. So I'm asking for your understanding and patience, and Christine is asking the same from all of the communities as well.
So not everybody is going to have access to social media and possibly see this clip and this communication. We're needing to rely on all our channels of communication, so please share this message that Dr. Murphy has just shared with you all. Get it out to our elderly people, anyone, our homeless brothers and sisters, anyone who you think that needs to know this information, share it amongst yourselves.
And obviously, if you are critically unwell and you need help from a doctor or a nurse in a hospital, that's what we're here for. So what we're talking about is people who perhaps do not need to be in a hospital, do not need to come in and sit in an outpatient's department waiting with their friends, who do not need to come and see patients on wards in numbers of more than 1 or 2. We will only be allowing 1 visitor per patient per time for that, because we have to. We hope you understand the reasons behind this, and all of us here are here to support any of you. So if you've got any concerns about any of this, please contact the hospitals and health services if you need to. And remember, your local GPs, your local support networks are there to help you as well. This is asking for understanding and patience from you all, and we know that you'll help us in doing this. Thank you.